everyone. My name is Ritchie. I am currently a PGY1 Pharmacy Resident at Baystate Medical Center in Springfield, Massachusetts. I graduated from the University of Rhode Island with my Pharm.D in May of 2020. And I originally came from Santa Clarita, California. So traveled from coast to coast to get my degree and then ended up staying East Coast because I love it over here.
Great. So what made you decide to do a residency?
So I was very undecided, I would say, going into even my APA year in terms of what I was going to pursue following graduation. I was very open to community pharmacy as well as residency. All of my work experience so far throughout pharmacy school had actually been in community pharmacy. So I had a feeling that I was going to go down that route. But then after having my institutional rotation, which ended up being more of a gen med where I got to shadow clinical pharmacists and really get a feel for all different areas and aspects of hospital pharmacy care. And that was my my summer 2 block, I'm sorry. I just absolutely fell in love with it. I loved being inpatient. I loved the excitement of working on a team with doctors and nurses and physical therapists and dietitians to care for the patients. And I loved the acuity of patient care. So just like high level of care that was needed. And yeah, that was ultimately what pushed me to start looking into residencies. So I really didn't decide until August of P4 year that I was going to pursue residency. But it was just the excitement of inpatient care that caught my attention, and just the fact that pharmacists can play such a role in the inpatient setting as well. It was a tough decision to make because I loved community pharmacy as well. And I met a lot of great pharmacists out in the community and obviously enjoy the patient care aspect. But I'm excited to be inpatient, and residency has been fantastic so far, which I'm sure we will talk a lot about. So excited to share that. But I definitely think I made the right decision in terms of pursuing residency and my future career.
Good. Well, I'm glad that you're happy and that you think you chose the right one. So what is your favorite part of your residency so far? Like, what's been like that top, like #1 moment? You're like, oh my gosh, this is fantastic.
Yeah, I mean, I definitely have loved every minute of it so far. Residency is definitely a challenging year because you're expected to learn so much and accomplish so much in such a short time period. A lot of people describe it as like 3 years of experience in one. So it's definitely a busy year with lots of learning and lots of experience. I would say what I've loved so far the most is being in the ICUs. And here at Baystate, we have a few different ICUs. So we have our medical ICU, our surgical ICU, heart and vascular critical care unit, which is like all of our cardiac patients, and then a pediatric ICU and neonatal ICU. So within my second month of residency, I got to spend a month in the medical ICU or MICU. And the teaching team there, since we are a teaching hospital, was just absolutely incredible. So the attending physicians, all the resident physicians, they loved having me as part of the team. The preceptor for critical care here at Baystate takes the approach of just kind of launching us into practice. So she has us grounding by ourselves on day one. She's there to support us like, through our messaging system, or she's on another place on the unit, so we can always walk over to her if we have a question. But it was really exciting to be like, wow, I'm 2 months into residency. I'm by myself in the ICU. And with all of these incredibly smart physicians and nurses who are so fantastic at patient care, and they're looking to me for answers, and they're asking me to teach them about things. So I thought that was a really cool moment. I loved that entire month. Like I said, I've loved it all, but that was just one of the places where, you're taking care of patients who need a high level of care. They need a lot of input from all different team members to care for them holistically. And I just felt really respected, and it was super exciting to be so early on in residency and feel like I was making an impact on patient care and on the teams that I was working with. So I'd have to say my favorite part of residency, like in general, is just the teaching environment. I love that everyone is willing to teach and learn here, and that they all are like excited to have pharmacy as part of the team. So that's been awesome.
Well, good. So are you the only resident there, or are there other pharmacy residents as well?
We have 5 PGY1s, so I'm one of 5 for PGY1s, and then we have 2 PGY2s as well. So we have a PGY2 in critical care and then a PGY2 in ID. So that's kind of our inpatient residency team. We actually also have 2 community residents who we sometimes cross paths with, but they work more in our like ambulatory care settings in our community pharmacy. But yeah, we have quite the crew, but it's been really great to have people to kind of go through the year with, and like the built-in support system, I guess, which has been great. So yeah, I have some awesome co-residents that I get to work with.
Well, good. That's really great. So, you've had experience with PGY2s and you get to talk to them. Are you looking at doing a PGY2 or what are your next steps after your residency?
Yeah, so I actually loved Baystate and that rotation in the NICU so much that I applied for early commitment for PGY2 in critical care here, and was offered the position. So I'm actually going to be staying on here for a second year next year.
Oh,
Yeah, I'm so excited.
congratulations. Oh, that's so
Thank
exciting.
you.
Good to hear. Oh, I'm sure it must be nice. You get to stay where you're happy and where you feel like you're in a good learning environment. So it's really cool. Um,
Yes.
so what has been the most challenging aspect of your residency? You kind of started this whole process, with COVID and all of everything that's going on right now. So what do you think has been the most challenging part so far?
Yeah, I would definitely say that with COVID, obviously, as much as the program has tried to stick to the usual formats of everything and the usual rotations, we've definitely been asked to stay on our toes and kind of be flexible with the needs of the institution and just the needs of the healthcare industry right now with everything that's going on. Initially, with caring for so many patients that needed that high level of ICU care, and then transitioning into rollout of COVID-19 vaccinations. That was something that residents played a huge role in here, getting our vaccine clinic up and running, vaccinating all of our employees, and now on to vaccinating the public. So that was definitely a challenge, I guess, was the flexibility of being able to all of a sudden pick up and start this clinic with the managers of the pharmacy department and our director. We really had a huge role in the beginning, and it somewhat interrupted our like normal rotations and ambulatory clinics. So I think trying to be on our toes for that, especially in something that we had no time to plan for, like anything like that, it was pretty much like, okay, we got the EUA approved for these vaccines, like we're going to start next week as soon as we get vaccine shipment. It was a very fast process. Incredible to be part of. And yeah, like a great learning experience, just something totally unexpected that kind of happened in the blink of an eye. So that was, I guess, like a challenging part of the year, just because it was a whirlwind of planning. And then all of a sudden we were vaccinating hundreds of people a day before we even like could realize what was going on. And aside from that, I would just say it's like the typical challenges that you hear with residency in terms of like time management. You have you have high expectations of you as a resident. Everyone wants you to learn as much as you possibly can in a short period of time. So we have a lot of just like assignments, presentations, in terms of like continuing education presentations, grand rounds. We teach and precept a lot of pharmacy students. So just like a lot of layers of responsibility. But I think that it really is the best way to prepare me for practice. So everything that I'm doing, I feel like it gets me one step closer to being able to be an independent practicing pharmacist. So time management is challenging, but I think that's expected for probably most residency programs. And it's worth it. It's a tough year, but I think you walk away with so much that you really couldn't gain from, just walking into practice on the first day. So challenging, but worth it.
No, agreed. So how was the transition from student to a resident? So kind of what process did you go through? When did you start? Kind of walk us through that.
Yeah, that was definitely one of the things I was most nervous about after graduating. You spend all these years in pharmacy classes and trying to prepare yourself for what comes next. And then all of a sudden you're going to bed the night before your first day of residency thinking like, how am I going to do this? Am I really qualified to be a pharmacist? Obviously you take steps like taking your NAPLEX and MPJ and getting actually licensed. So that was a big piece of the transition, was kind of taking that step from student to all of a sudden you have your license. And then from there, it's really about changing your mindset to acknowledging that you are the pharmacist now. And I mean, granted, we all take a lot of high responsibility for our patient care as students, but you also have kind of the blanket of someone else is the one that's actually like officially making the recommendations, or they're the ones like verifying the orders. And then all of a sudden one day you wake up and that's you're the one verifying the orders and you're the one that's making the recommendations. So I think that like acknowledging that you have to have a pretty big shift in mindset is important. The best way for me to do that was just talking with my preceptors and trying to help build up my confidence as a pharmacist, because it can be a little bit intimidating in the beginning just because it all of a sudden feels very real. And now all of a sudden you're owning these patients, you're owning your own practice. And, people turn to you, like you're the one with the degree now. They expect you to have the answers, or at least hope that you have the answers or know where to look them up. Certainly have to look up plenty of things all the time. But yeah, I think finding a support system that will help kind of guide you along the way, build your confidence, give you feedback when necessary, and give you ways to help improve your practice. I think that's what was really helpful in the transition. I will definitely say the early months of residency, so July, August, September, where it was still very new, probably a little bit rocky in terms of verifying orders or sending things to the wrong printers or not knowing what exactly I was doing. But that's another one of the perks of residency. You still have preceptors who are kind of watching over you, and they'll answer any questions that you have. They'll double check all your work in the beginning. So that made me feel a little bit better. I wasn't fully on my own from the day of licensure, which is definitely a good thing. So yeah, it's an interesting transition. It was easier than I expected overall, because you kind of have no choice but to step into the role. Again, like once you have that title, that license, no one really, I mean, they'll acknowledge the fact that you're newer and they'll be patient with you, but at the same time, like you have that power now, so you're able to verify orders or make official recommendations and such. So I think just finding people that will kind of help boost your confidence is really helpful, and giving yourself that confidence. So acknowledging that, you passed your exams, you got your license, you went through pharmacy school, got your doctorate, you're totally qualified to be there. And now you just have to learn exactly how to be the pharmacist instead of how to be the student.
So kind of bringing it back to URI. So how do you think URI has prepared you for your role as a resident now?
Yeah, I felt so prepared. I mean, I loved URI from the minute I toured the school. So I'm excited to talk more about URI later, but I am so grateful for the experience and the knowledge that I gained while I was there. Obviously, the classes in general are designed to give you all the knowledge that you need to know going into residency or going into community pharmacy or wherever you're going to go to practice. You definitely have the knowledge base from the classes. Sometimes you have to, see certain patients or be in certain scenarios to dig up some of the knowledge that might be deep in there. But you definitely learn everything that you need to learn. And what I loved about URI and what I think is so special about it is how prepared you are for all other aspects of patient care. So not only do we have the classes and gain the knowledge that we need, but I feel like we had so many opportunities, for example, doing OSCEs in lab or doing patient counseling where we got to practice kind of that next level of care. We got to practice actually talking to patients and family members, or mock patients as they are, but you actually got to practice that patient interaction and family interaction. In sim lab, you got to practice, what do I do when the patient or sim mannequin in the case of labs is having a really high fever or their blood pressure is dropping. You get to be in those scenarios where you kind of take your practice to the next level. And I feel like all of those things, in addition to all of the other ways to get involved in the College of Pharmacy and outside the College of Pharmacy, really prepare you for just like anything that comes your way. I definitely felt prepared for the time management aspect. I felt prepared for the public speaking aspect. All of the skills that I did not have going into college, I definitely left having those skills from URI. And it's been really, really helpful throughout this residency year, having those skills to build on. So yeah, I will go on all day about how URI is the best pharmacy program.
Always. It's always the best pharmacy program. I tell everybody, I'm like, yours is fine. Yours is ass. Like, we're the best.
Yes, I agree wholeheartedly.
So what was your favorite class at URI? What was your favorite pharmacy class you took at URI?
Oh man.
You had to pick just one. Like you would tell every P1 student, take this class.
I definitely think that one of my favorite classes, and it kind of ties into like what I was just talking about the hands-on experience and gaining those other skills, would be the geriatrics elective with Dr. Estes and Dr. Eisenhower. And that's just because it's a smaller class where they get to spend a lot of time doing more interactive activities. We get to do like senior day where you're spending time actually learning about your own patient who's coming from the senior center, looking at all their medications, reviewing their past medical history, and kind of taking ownership of that patient, looking up what recommendations you might make to their primary care provider about like, medications that maybe we could trial stopping or deprescribing, medications that maybe we could simplify their dosing regimen or things like that to improve their quality of life. And then we actually get to go meet our patients with physical therapy students and other interdisciplinary students, and kind of have like a senior day all together where we just help to make their lives and their care better. We also get to do like interactive things in the classroom, such as like pretending that we're going pharmacy with maybe some sort of like aging disability, such as losing your vision or losing your sense of feeling in your hands, and seeing what it's like to navigate the healthcare system when you have those additional challenges, which in turn helps the pharmacy student have an increased level of empathy for these patients that maybe have a harder time navigating the healthcare system on their own. So I'd have to say that was my favorite class just because it was so hands-on and interactive. And yeah, I think for me, I learn best when I actually get to do things. So while I loved all the classes and you learn a lot in all of them, some of the ones where I just had to listen to lectures and take notes and study for exams were a little bit harder for me or more stressful than the ones where I actually got to do things to practice learning. So yeah, we'll go with the geriatric selective.
Okay. Dr. Estes gets that nice shout out.
Yes, we love Dr. Estes.
We do. She's amazing. So we talked a little bit about your time at URI, but like, so we always love to tell all of our students that come in that are looking to go to URI that we're not just pharmacy students, that we do so much more. And you are the perfect representation of that. So would you mind talking a little bit more about your time at URI and what are some of the things you did?
Yeah, I would love to. So that's actually one of the reasons, I guess, partially that I came to URI. I knew that something that was important to me was that I was going to be able to have a well-rounded college experience. And I was nervous when I had visited some of the other pharmacy programs. I felt like they were going to be so competitive, or like I was going to be so like lonely and independent and trying to navigate my college education. And the minute that I set foot on URI's campus, and especially the first time I walked into the pharmacy building on tour, I could see that it was such a collaborative environment and that the university as a whole really promotes getting a well-rounded experience. And that was important to me. You know, I wanted to have a group of friends or a group of like study buddies that I could study for exams for. I wanted to get involved outside the College of Pharmacy so that I could really have that college experience and get to know other people outside of pharmacy. So I definitely took that approach when I got there, actually even before I got there. So in April, leading up to when I was going to start college in the fall, I actually submitted a video tryout for the dance team, the URI Ramettes. And that ended up being one of my favorite parts of my college experience. So I got accepted to be on the dance team, subsequently was on the dance team for 5 years and spent 3 years as captain of the dance team. So definitely a big piece of my heart goes out to URI Ramettes and all of the Rhody athletic programs. Some other things that I got involved in, also in my freshman year, I applied to be a tour guide at the university and got hired to be a tour guide. So I started doing that my first year. Spent a few years as just a general tour guide, giving tours of the campus to all prospective students and families, walking backwards, the whole deal, you know how it goes. And then I became a tour guide trainer. So I got to train the newly hired tour guides, and ultimately ended up being the program coordinator and overseeing the entire tour guide program with our Office of Admissions. So that was a really valuable experience for me. Gained a lot of leadership through that. I guess all of the roles there. And yeah, just really got to know and love the campus even more than I ever thought I could have. I couldn't tell you all of the facts now or all the numbers, but at one time I could tell you every single statistic about URI, every single fact that you needed to know. So that really helped me like get closer to the school as a whole. And I met a lot of really, really wonderful leaders and people who were passionate about the university and wanted to share that with prospective students and families. So yeah, definitely created a great network there. My second year, I joined Lambda Kappa Sigma, which is the professional pharmacy sorority. So that is a great way to get involved within pharmacy. We have a ton of great organizations that kind of help you connect with other pharmacy students and pharmacy faculty members and kind of play a role in the area of pharmacy that you're interested in. So that one is great because it created a sisterhood. I got to meet older sisters who were older in pharmacy school and were able to give me great advice. My big Sarah Chin was like one of my biggest role models. She actually worked at Green Line Apothecary, which is the independent pharmacy that I got to work at during school. So she helped me make connections with other people within the pharmacy world that ended up having a huge impact on me and kind of being mentors to me throughout pharmacy school. Let's see. Also, my second year, I got involved in orientation. Sorry, I'm rambling a little bit. There's a lot of things on the list.
So important because we always really stress that we're not just pharmacy students, that we're so involved in the community. So it's great. Plus, I love like hearing all these really cool things you used to do.
Yes, I have so many fun things to share. Definitely the glory days. Yeah, so second year, I also got involved in the orientation program at URI. That was another thing that I really wanted to do ever since being a student at orientation prior the summer prior to starting school. And that was because as someone who was coming all the way across the country from California, I didn't have any friends or any family members on the East Coast, didn't know anyone going to URI. And that can be scary. I think, especially in the pharmacy program, we have a lot of students coming from a lot of different places in the country. And I think it's really important for them to know that URI will definitely be a place that they can call home. I definitely call it my second home now. And like I said, I stayed out here on the East Coast. Like, I feel like I've become an East Coast girl. I will always have that California girl in my heart, but definitely URI creates the kind of environment where you can find that second home and, really be comfortable and be yourself. And it's a place where you can grow a lot. So I felt like orientation is what kicked that off for me before starting my first year of school. And I wanted to be able to have that impact on other students coming in and show them how awesome URI could be. So I got involved in the orientation program. My first summer, I was an orientation leader. Second summer, I was a team leader. So I was responsible for some of our newer orientation leaders and helping train them and guide them through the summer of just introducing the school to all of our new students. And then after that, I spent a year as logistics coordinator. So coordinating all of the behind the scenes things for the orientation program. And rounded out my fourth year with orientation as the student coordinator. So coordinating the student program as a whole. So that was another really amazing piece of involvement. I feel like I was able to have such a big impact on incoming students and their families' lives. And again, met some of the greatest people that I've met at URI. Some of my lifelong friends I've met through orientation, and a lot of people that I wouldn't have met if I hadn't gotten involved in it. So I think that's another key point to stress about, pharmacy is amazing. You're going to meet a lot of amazing friends and future coworkers and things through the program. But I also think it's important to get that experience where you're meeting people that you might not otherwise work with. So I have a lot of friends in nursing who I'm hoping that maybe our future paths will cross in the hospital and we can work together. A lot of accounting friends who make sure I do my taxes correctly now. So just finding that network kind of outside of pharmacy was really important for me. And I feel like it made a big difference. And again, all of those attributes or those skills that I was talking about before that helped me be successful in residency. While a lot of those came from pharmacy, a lot of them also came from being involved outside pharmacy and just learning from so many different faculty members and staff and leaders on campus. So yeah, definitely a lot of options in terms of getting involved outside of College of Pharmacy. And yeah, a lot of wonderful people that you'll meet at school and a lot of things you'll learn. So I'm excited I can be an example of that. And I hope that everyone feels that they can get involved outside and kind of make their college experience their own.
Oh, yes. So a lot of the students you still know, we're P3, we're P2s, P3s. And so we're kind of looking at our options for after grad. So what are your biggest recommendations for current students who are looking at residencies or looking at fellowships or looking for those steps for post-grad? So you want to talk a little bit about those?
Yeah, absolutely. The residency process and the fellowship process pretty much mirrors, I guess, what you go through for residency, just on a little bit of a different time frame. It can be stressful. There's obviously a lot that goes into it. Like I had mentioned before, I was kind of late to the game in terms of deciding I wanted to pursue residency. So I feel like I was almost playing catch up. I would definitely encourage those of you that are P2s and P3s that if you're confident that you want to do residency, definitely start looking early. That's by no means to say that you have to have everything done a year in advance of when things are due or things like that. But it takes a good amount of time to kind of research the programs to try and figure out what it is that you're looking for in a program. I would definitely recommend starting to look at programs early. Before you even look at programs, maybe make a list of things that are important to you. So for me, that was I really wanted a program that had a positive environment for learning, where when I met people, I felt like they were going to support me through my journey and not just spend time torturing me, asking me 100 questions a minute, or that weren't really going to support me through the transition of changing from a student to a pharmacist or a pharmacy resident. So the environment for learning was a big thing for me. I was looking for well-rounded rotations. So some things that I knew I was interested in before starting residency were critical care, emergency medicine, and oncology. So those were 3 rotations that I was definitely looking for. And I wanted to get some pediatric experience too, as well as just a generally well-rounded experience in residency. Because there's so many things that we don't get to spend a lot of time on in pharmacy school with, for example, pediatrics being one of them. And as I mentioned before, I ended up doing the geriatrics elective. So I didn't even do a pediatrics elective. Some of the more like specialized areas, you have to kind of pursue the learning for those. So I wanted a residency that would, I guess, give me like exposure to every possible area of pharmacy. So that was another criteria I was looking for. I also am really interested in academia and teaching. So I wanted a program that had like either a teaching seminar or a teaching certificate, so that I could learn from faculty members of nearby colleges of pharmacy. Yeah, so those were kind of my three big, I guess, like things I was looking for. So I would definitely say it's important for each individual to sit down and say, you know, what am I looking for in a program? What do I want to gain from residency? Because as much as all of these programs will offer similar things, they all have kind of like their niche of like what's special about the program. So it's important to go into searching with like some sort of an idea of what you might be interested in. Otherwise, you're going to get bogged down by the hundreds and hundreds of residency programs that are offered around the country. I would also, oh, what was that?
There's a lot of them.
Yes, it would be very hard to look through everything. So I think it's important to kind of have a few things that will help you narrow it down to start. And then you can really do like a deeper dive into programs that definitely meet those criteria. Otherwise, it's going to be overwhelming trying to look through every single program across the country. So that was kind of where I started. From there, I looked at individual programs and started reviewing their like policies or just like really kind of what they were about, what they had to offer, and narrowed it down from there. I was open to going anywhere in the country, but that would also be something to consider. Like if you're limited geographically to where you can go, obviously looking within that region. If you're not limited geographically, maybe looking at like a few places here and there. Because again, it's going to be challenging to look at every single program. I would also encourage students to reach out to a faculty member that they're close to, or maybe an older student who's already gone into residency and went through the process, to get advice on programs that they know about that they think you might be a good match for. I found that to be really helpful throughout the process for me, like talking with Dr. Estes and talking with Dr. Ward, trying to get a feel for programs that they had either had previous students go to that they knew about, or programs that they had connections with from maybe people they went to school with who now are preceptors or directors of these programs. And they would kind of give me advice on like which programs they thought might be a good match for me or where I could look. So I would definitely try to reach out to people who can be a support system for you along the way. Faculty members are also going to be a great resource when it comes down to actually like writing your letter of intent, working on your CV and all the other things that are required for the applications. So I'd say early on, try to define who your support system is going to be, who's going to proofread everything for you. Yeah, I guess that's the initial. Wow, I have so much to say. I'm so sorry. I always do this.
Oh, you're good. It's great. I'm still looking at residency. So I'm like, ooh, perfect. She's a great person to talk to.
Yeah, hopefully this helps. Yes, I'd say that's the best place to start kind of for your like initial looking. And I would do that early on in your P4 year, or like you said, if you know you're interested as a P3 or even as a P2, maybe start that process early on. When it gets down to actually getting into like the nitty gritty of residency applications, I would definitely say start as early as you can. So in terms of like writing your skeleton for your letter of intent and starting to prepare for that, you know, the faculty members, Dr. Charpentier, Dr. Ward will encourage you to do it early on. Definitely listen to their deadlines because it will be very helpful for you to get ahead. And it's very easy to get behind because obviously you already have a lot of responsibilities as an APPE student, maybe with your job outside of school or other involvement, you know, you're busy. So starting early is important. Having people proofread everything that you do. I would encourage everyone to take advantage of the opportunities that URI provides. They are very, very supportive and helpful throughout the residency application process in terms of reviewing your letter of intent and your CV, in terms of offering mock interviews with different faculty members who can give you feedback on your interviewing skills and your interview answers. Definitely take advantage of all of that. The other thing that I found really helpful was I had my mom read everything for me as well. And that's just because she knows me inside and out, probably knows me better than I know myself. So I trust her to kind of read things that I'm writing and let me know if it accurately portrays the person that I am, the student that I am, the future pharmacist that I am. So if you have maybe like a friend or a family member who knows you really well, asking them to read it too, because you kind of want to make sure that it is portraying like all of your materials, your application materials are portraying everything you have to offer. And you have to remember that a lot of times the people who are reviewing your applications are complete strangers to you. So as much as it's important for them to look at your grades and look at what you've accomplished in pharmacy school, you also want to let some of your personality shine through, and you want them to get to know like what motivates you, what inspired you to go into pharmacy or into residency, where do you see yourself going in terms of your career? Like they want to know you outside of just what they can learn on paper. So trying to let your just like your personality shine through is important. And I think that people who know you well can help you do that. Because typically pharmacy students, and I think just people in general, struggle to like highlight all of their best attributes. It's hard to sit down and say, what are the best things about me? Like that feels weird to do. So talk to people about it, get their input. I would like text some of my friends and just say, what do you think are like my strongest qualities? And that was stuff that would help me out to make sure that I was like portraying myself in a way that was accurate. So definitely think that would be helpful. And then, when it comes down to interviews, it's really just the same thing, making sure you're prepared, trying to think of things that you've done throughout your entire pharmacy career, as well as how things you've been involved in outside of pharmacy. Because again, the interviewers are going to ask you questions that are pharmacy related, but they'll also ask you things related to leadership, related to how you are working on a team, related to how do you handle difficult situations or times of failure. So they want to get to know you as a whole person. So I think just like sitting down ahead of interviews and trying to think like, what are some things that I've accomplished? Where are some areas that I struggled? How did I overcome those struggles? And really thinking ahead of time of like, your most important moments throughout your college career or your life. And then, being ready and able to articulate those to the interviewers. And the last thing I'll say, and then I'll turn it back over to you, is that for interview questions as well, I did the same thing. So I sat down with my mom and I had printed out the ASHP interview guidance document that had, like hundreds of examples of interview questions. And we just like talked about them back and forth. So she would read a question to me. I would tell her my answer. She would say, well, what about the time that you did this? Don't you think that would be something good to share? Or she would like give me critiques on like, how I was coming off. Because sometimes it's hard to tell when you're speaking if you're coming off as like overly excited or if you're coming off as like the perfect level of excitement or if you are sounding uninterested altogether. So I think it's really good to practice saying those answers out loud with someone. Or even if you like record yourself saying them, I think that would be helpful prior to interviews. And it helps you stay more calm during the interviews because those are stressful days. I had a lot of heart palpitations and sweaty armpits on those days. So the more prepared you can be, the better you'll feel when you actually show up to those interviews. Hopefully by next year, you'll be able to do in-person interviews again too, and won't have to do all of the virtual stuff because that's obviously another level of challenging interviewing.
Yes, I'm sure. I'm kind of hoping that they'll be in person because then you get to travel for a little bit and you fly wherever. I think that sounds really cool.
Yeah, that was definitely one of the most exciting parts of interview season. It's definitely stressful. I'm trying to balance like rotation with traveling and seeing places. But it was so awesome. And I feel like it's really important when you have the opportunity to be able to like get a feel for what the hospital actually looks like, how do people interact with each other? And unfortunately, that's the stuff that you kind of lose with the virtual interviews, but hopefully we're trending in the right direction with vaccinating and all of the other precautions. And you guys will all have the opportunity to be in person and see your future institutions.
I hope so. I'm like, oh, look, I've been vaccinated. It's fine. I can go.
Right.
But
soon.
I know. I'm hoping. But let's see. I'm just reading my questions. Ian will edit this out. I love Ian. He's great. All right.
Yeah, this is awesome that it's going to be edited.
I know, right? I'm like, oh, thank God. Let's see. I think really one of the last questions that we kind of went over a little bit, you touched on some things briefly, but what is your best advice for students who are looking to pursue a doctorate here at URI, who are looking to go in this Pharm.D program, or even if they're kind of on the border between Pharm.D, Pharm.Sci, like what's your best advice?
Yeah, well, in terms of choosing between programs or choosing, what degree you actually want to pursue, I would encourage everyone who's interested in pharmacy, even a little bit, to start out in the Pharm.D program, apply for it, accept your admission, because you're going to get that really well-rounded experience. You're going to come out with a degree that can take you anywhere in pharmacy, and you're going to get exposed to all the different areas of pharmacy throughout school. I would say the most important thing is to come in with an open mindset. And be excited about pharmacy, but also try to challenge yourself to see what else you can gain from University of Rhode Island as a whole, because there are so many things that the campus has to offer. Obviously, with a number one being the fantastic pharmacy program, I cannot talk great enough about how much I gained from the program. But there's also so many other areas where you can gain skills and you can meet people and create your network or build your network. And I think that's really important too. So I would say, come in with an open mind, get excited about something. It can be anything. For me, I love dancing. I grew up as a dancer, so it was Ramettes. And then, I fell in love with URI and I wanted to share that with people. So that's what led to tour guiding and orientation. If that's surfing for you, join the surf club. If you're interested in Greek life and, making a difference in terms of philanthropy and meeting a lot of other people, pursue that. I was nervous in the beginning because you're kind of questioning, do I have enough time for all of this as a pharmacy student? Am I going to be able to balance schoolwork with everything else? And the answer is sometimes you won't get a lot of sleep, but you will figure it out. You'll find a way and it will 100% be worth it. So that's my best piece of advice. Be open to it and then be willing to jump in and try things. If you try something and you don't like it, you don't have to stick with it. But you never know, you may try something and fall in love with it and end up doing it for the entire 5 or 6 years of your pharmacy and URI career. I think that's the best advice that I have. That was what made a difference for me. And, I've definitely seen that make a difference for a lot of people who have gone to URI.
Thank you so much for your time. It was really enlightening to listen to you, to talk with you about your experiences, especially because those are things that we're all really going through right now. We're looking at the residency process, and all of our students who are looking at this are somewhere along their pharmacy career. So whether they're looking at joining URI and coming here, or if they're a current student. And so it's really great to have this opportunity to talk to students like you who have gone through the program and can't stop singing the praises of URI. So I did just want to thank you so much for your time.